How does skin heal after a burn? Have you ever wondered what happens to your skin after a burn? The healing process is fascinating and involves several important steps. When skin is burned, the depth and severity of the burn play a big role in how it heals. Burns damage the skin's layers, triggering a complex repair process. Let's break it down. Right after a burn occurs, the body kicks into action with an inflammatory response. Blood vessels near the injury expand, bringing immune cells, nutrients, and oxygen to the area. This causes redness, swelling, and warmth. The inflammation is essential as it helps remove damaged cells and prevents infection. Next comes the cleaning phase. Immune cells work hard to clear away dead skin cells and damaged tissue. This step is crucial because it prepares the wound bed for new tissue growth. In survival situations, keeping the burn clean and protected from dirt and bacteria is vital to avoid infection, which can delay healing significantly. Then, we move on to new tissue formation, also known as proliferation. The skin begins to rebuild itself by producing new cells. Fibroblasts create collagen, a protein that forms the structural framework for new skin. New blood vessels form to supply the healing tissue. For superficial burns, new skin cells grow from the edges and hair follicles to cover the wound. Finally, we reach the maturation and remodeling stage. Over weeks to months, the new tissue strengthens and matures. Collagen fibers reorganize to improve skin strength and elasticity. Pigmentation and texture gradually return closer to normal, although scars may form depending on the burn's depth. Understanding burn depth is also important. Superficial burns, which are first-degree burns, affect only the outer skin layer, known as the epidermis. These heal within days without scarring. Partial thickness burns, or second-degree burns, damage deeper layers, including the dermis. Healing can take weeks and may leave scars. Blisters often from and should be left intact to protect the new skin underneath. Full-thickness burns, or degree burns, destroy all skin layers and sometimes underlying tissues. These burns do not heal on their own and requiring medical intervention, such as skin grafting. Now let's talk about practical survival skills for burn care. First, stop the burning process immediately by removing the person from the source and extinguishing flames or heat. Next, cool the burn promptly with cool running water for about 10 to 20 minutes. This helps reduce heat, pain, and tissue damage. Avoid using ice, as it can worsen the injury by constricting blood vessels. After cooling the burn, protect the wound by covering it with a clean, non-stick dressing or cling film. This keeps out contaminants and reduces pain. It is important to avoid breaking blisters, as they protect the healing skin underneath. Maintaining hydration and nutrition is also essential to support the body's healing processes. Burns increase fluid loss, so drinking plenty of water is crucial. Lastly, keep an eye out for signs of infection and complications, such as increased redness, swelling, pus, or fever. In survival settings, evacuation may be necessary for severe burns or if airway injury is suspected. Understanding how skin heals after a burn helps prioritize first aid steps that support natural repair while preventing further damage or infection. Quick cooling, wound protection, and hydration are key to improving outcomes until advanced care is available.